Welcome to yet another episode of Guest Room. Today we have with us Dr. Thilak Karla, who have been specialized in acupuncture. Let's welcome him to the program. Welcome, doctor.
Thank you.
First of all, we would like to know more about you.
More about me. I am a chemical engineer. I studied chemical engineering from Banaras Hindu University. I passed out in 1963. Then I was a lecturer at Roorkee University for 3 years. Then Monash University in Australia in Melbourne gave me a scholarship to do PhD in chemical engineering, which I finished in 1971. And before I finished, I was offered a job with ICI, Imperial Chemical Industries. I worked there for 1 year. Then I started working for the government in the Department of Environment and Planning in Canberra. I was there for 4 years. Then I moved to Sydney, again State Pollution Control Commission, and then I was moved to Department of Environment and Planning, where I was working in the area of environmental impact assessment of big projects like coal mines, aluminium smelters, and other projects. But somewhere around about 28 years ago, I had a neck problem, and acupuncture helped me. So I decided to do acupuncture course. In those days, acupuncture was done only part-time. While I was working, I did this course and I finished out in 1986. And then I went to China for a month because we had to do 350 clinical hours. So I finished that course, then I started doing a little bit of work. And then 1990, one of the doctor came and saw me and he said, my brother-in-law has a knee problem. Can you help me? We have consulted 2 orthopedic surgeons and they say there's nothing wrong with him. I said, I'll give my best shot. So I treated him within 4 sittings and they said, why don't you join us? So I started in a medical center from there on. And that was a very challenging, and they gave me all difficult patients. I'll give you one example. They gave me a lady, 37 years old, 3 kids, wetting the bed 7 nights a week. And they told me to fix her, which I did. Took about 10-12 sittings, but I fixed her. So similarly, they were giving me, there's another example, I'll give it to you. Gave me another patient, about 37, 40 years, and she was having pain in the abdominal area. So the doctor did the endoscopy, they didn't find anything. They did ultrasound of all the organs, they didn't find anything. Then they did a CT scan of the back, they didn't find anything. They did the blood test, they didn't find anything. Then they pushed her to me. Now, the only thing she told me, 10 years ago when she gave a birth to her son, she hurt her coccyx area, the tailbone. All right, now I had to think about what can be the problem. So when you have a tail problem, you don't sit the way I'm sitting, you sit forward like this. So there is no pressure on the tailbone. So I told her, go and get by yourself a hemorrhoid ring, which is a ring. You sit on it and your tailbone is not touching the ground or table. And 4 sittings I fixed her. So that's how I started working. And then I never advertise. One tell the other and the other tell the other. That's how business grew. So I treated a lot of things and I learned a lot of my patients. And what I find about me is, a lot of time doctors send me, like, this person had a car accident. Can you have a look? We had an x-ray, there's nothing wrong in the lumbar area. Now first sitting, I checked them thoroughly and I checked them, I said, no, this person has got a lumbar problem, and I wrote down L5S1. Anyway, they did CT scan, they didn't find anything. When they did the MRI, the lady brought the report with me and I said, well, have a look at my card. Exactly the same thing, which I did. And that I said to you from posture, that's where I started working on a posture. People coming for neck problem. So I used to ask them, how well you sleep? what position you sleep, which is very important. That's how I gave a lecture on posture. That was one of the reasons. Because a lot of time, doctors ignore these basic things, like sleep. If you got how well you sleep, then what position you sleep. And if you're not sleeping well, your immunity goes down all the time, and you're going down and down. And you can catch anything you find. That's one of the stories. But I have been in Australia for 47 years, and I think the last 20 odd years I have been doing acupuncture, and I've been reasonably successful.
Okay. Could you explain to a layman what actually acupuncture is?
Acupuncture is basically putting very fine needles in certain points on the body, which are called acupuncture points. And they release certain chemicals. There are 4 theories basically about it. The first theory is that when you put a needle, body releases certain chemicals, body's own painkillers. So once the pain is gone, then you can move the body. Once you're moving, improve the circulation, so the body gets fixed. The second is what happens to a muscle when it's injured. It swells up. So the only thing which can reach the body of the muscle is a needle. When you put the needle in, this research was done in Canada. When you put the needle in, body releases certain chemicals. The muscle relaxes, the swelling goes, so the pain goes, and you fix yourself. Now there is a third which is still being investigated quite a bit. Some doctors are using very high resolution MRI machines. So what they're doing is they're putting an acupuncture needle in one of the acupuncture points, and then they do scan of the brain. And what they have found is there is a change in the pain perception area of the brain. These are the Western theories. Chinese theory is very similar to our Ayurveda. That means when there is an injury or pain, body gets imbalanced. So basically what we're doing is trying to balance the body, and that's the principle of acupuncture.
Okay.
And also diagnosis is very similar to Ayurveda. They take pulse diagnosis exactly the same way. There is a slight difference. In Ayurveda, you take only one hand. In acupuncture, you need both hands. Now, you do superficially 3 and 3 deep. 6 on this hand, 6 on this hand. And there are 12 meridians. Each is linked to each meridian. And what it tells you, there are 28 qualities of pulses. And each, so like slow pulse, deep pulse, steady pulse, fast pulse. So there are 28 qualities. You can't learn from the book. You have to work with a master. I was in China, I've been to China many times, and they were trying to develop a machine to take the pulses. But you have to calibrate it. Who can calibrate? Only the master.
What made you enter into this field?
Well, as I said before, I had a neck problem, and acupuncture helped me, and that was one of the reasons I learned. Again, my grandfather was a doctor, my elder brother is a doctor, my father was a pharmacist. I was the first one to change to engineering.
How do we find different points for acupuncture for different diseases?
There is a chart there. Now, there are 2 ways of looking at it. As I said, one, the Chinese, the way they do it. They do with pulse diagnosis and tongue diagnosis. Again, tongue also you can diagnose. I'm not very good at it, but this is another thing, and the pulse diagnosis. What I use is, I use my hands. And by touching, I can feel where the problem is. Just asking the person where the problem is, and then I can touch the point where even the pain is. That's my experience. And I don't know how it works, but it does work, 90+%, which is pretty high.
What kind of treatment you give to the patients?
It's all variations. I have treated starting from lower back problems, shoulder problems. Again, also, there are specific points, like somebody can't raise the arm, so there are points in the leg, which releases some of they have worked it out. You can raise the arm straight away. I wouldn't say 100%, but depends on how bad the patient is.
Okay. Do they have to get hospitalized?
No.
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 Okay.
No. I see them in my own clinic.
Oh, okay. What are the machines you use?
Well, around about 2000, there's a lady came from America. She was a chiropractor. She has developed a new machine. It's called specific frequency microcurrent. It's one of the beauties. You will be surprised when I tell you what I have done. Somebody came with a car accident, whiplash, and can't move the neck at all. In one sitting, the movement will be 80%.
Oh.
Now, there is no needles involved in this. It's just a current, microcurrent, and you won't feel anything at all. I've treated people, those who got teeth extracted, you know how much swelling comes in? One sitting or two sitting at the most. I've treated my own son. He got 4 wisdom teeth removed on Thursday, treated him on Friday and Sunday, and after he started eating.
Oh.
What else I have treated with that is I have treated, you heard about shingles?
No.
Now that's one of the worst pains, is even worse than giving a jar bath. It's a nerve pain. It comes generally when you are young, you get chicken pox. Now the virus stays in you. As you grow older, some people take too many antibiotics or some other ways they get sick, the immunity goes down. So then the shingles come, it's like herpes. You have a herpes, you heard about that? Well, it's the same thing, but it can come anywhere. Once it comes on the face, it can affect your eye, right? It can affect the jaw, it can affect the upper body, it can affect the back. The blister comes in and they are very, very painful. Now I've treated them within 3 sittings with this machine.
Okay.
You heard about gout?
No.
No, gout is the one, uric acid. What happens is, people, those who drink a bit more, they get extra uric acid in the blood. Now the uric acid goes to the big toe in the form of crystals. Now you know anything you put foot on, even sand, you can feel it. And that's the terrible pain. And I remember a case I've treated a few others too. You can't touch the toe, big toe. That's where it starts. I could not touch it. After 1 hour, I could squeeze the toe.
Okay.
There are not many machines. I think in Australia there are about 120 machines in the whole of Australia. I mean, you can treat a lot of things. You treat low back problems. But the best results you get, like somebody came with a sprained ankle on crutches. All right? And by the time I finish after an hour, he can almost walk. But next day he'll be walking. So maybe one more sitting and that's it. You know how long it takes to take the swelling down of sprained ankle? About a week. Normal way when you treat.
If someone is having back pain, how do you treat them?
Firstly, you have to find what is the cause. Was it an injury? Was it a posture related? And once you find out what the problem is, you can put acupuncture needles. That's one treatment you can do. You can do moxa. Have you heard about cupping?
No.
Cupping is the one, I forget the Indian name, but cupping is done basically, it's like a cups, glass cups now. And you put a fire in that and you straight away take it out, put on the skin. It sucks the skin. Basically the principle is one of the oldest technique in the world. It is done all over the world, every country of the world. The only difference is they do cupping with different way. That's about all. And the old story goes, if your thumb goes into a car door, what happens? You have pain in the thumb, isn't it? and that blood, dirty blood, has to be released. Then the pain goes away. In the same way, when you put the cups in, if there is a pain, and when you put the cups on, what happens? The blood comes up.
Okay.
That's the principle used. Now, in a lot of places in Europe, when they were treating people with cold and flu and asthma. So they do in the upper back area, both sides, they put the cups on, and still people come from Europe when I treat them, oh, my grandmother used to do. Same thing coming from Middle East, exactly the same. Even from Poland, Russia, you name any country, it is done all over the world.
How do the people in Australia accept acupuncture?
Now, acupuncture, when it started, say about 30, 35 years ago, you had to get a doctor's referral to treat for acupuncture. Only then private health fund, only one health fund used to pay. It grew up slowly and slowly. When I finished my course, still all health funds, private health funds were not paying. Then they formed associations. When I was doing, it was a simple private college. Then it became a part of a TAFE college. Then it became a part of a university. So it is not only taught in Sydney, it's taught in Melbourne, Adelaide, Brisbane, other parts too now.
Okay.
Then Melbourne, Victoria, Victoria is the state, Melbourne is in there. They started registering acupuncturists. So that was accepted. Now 2.5 years ago, there were lobbies were done, and basically now we are registered. Like doctors, we are registered, but there is a slight difference. Now we have a universal health system. Acupuncture is still not paid by that. But again, at the same time, physiotherapy is not paid by that too. But all private health funds pay. At least we are recognized. And you can't write a title that you are an acupuncturist. And you can't buy stuff also, because under therapeutic course, you have to produce the certificate.
Doctor, thanks a lot for being a part of our program. That was nice talking to you.
My pleasure.
So that was Dr. Thilak Karla with us. Until we meet next time, this is me, Naina, signing off. Take care.